Hello, my name is Katie Deputy, and today I'll be talking about smoking and the effects it has on your health and your loved ones.
My name is Ariel Deputy, and I'm 21 years old.
My name's Nick Pruitt, and I'm 19 years old.
Stopping smoking will protect your loved ones from secondhand smoke and reduce risk of heart disease, stroke, vascular disease, respiratory disease, and various cancers, while also improving your overall health and well-being. Cigarette smoking causes about 1 of every 5 deaths in the United States each year. This is more than 480,000 deaths annually, including secondhand smoke. Nicotine is an incredibly addictive substance that affects not only our physical health, but also our mental health. It changes our brains, which makes us feel dependent upon it. In fact, the National Library of Medicine states tobacco addiction is a chronic brain disorder. Through extensive research, I've found that your lungs will have improved and start to clean themselves after 2 to 3 months of quitting, according to Healthline. You will go back to normal after quitting. After explaining why you should quit smoking and the benefits from it, I hope you will decide to take action to better yourself and your loved ones. Dr. Jerry T. Todd, Doctor of Medicine, states that the 3 main medical issues caused by smoking are heart disease, lung disease, and cancer. Smoking damages blood vessels and increases the risk of heart attack and stroke. Lung tissue is damaged by stroke and can cause breathing problems as well as increasing the risk of lung cancer. Other types of cancer related to smoking include leukemia, bladder cancer, colon cancer, head and neck cancer, and kidney cancer. In order to lower your chances of disease, cancer, and overall decreasing health, quitting smoking will not only benefit you in these ways, but also your loved ones. According to CDC, even people who do not smoke but are exposed to secondhand smoke, even for a short time, can suffer harmful health effects. There is no safe level of exposure to secondhand smoke. Even brief exposure can cause immediate harm. Health problems caused by secondhand smoke in adults who do not smoke include coronary heart disease, stroke, and lung cancer, as well as adverse reproductive health effects in women, including low birth weight. Secondhand smoke can cause sudden infant death syndrome, respiratory infections, ear infections, and asthma attacks in infants and children. The effects of secondhand smoke exposure on the body are immediate. Since 1964, about 2,500,000 people who do not smoke die from health problems caused by secondhand smoke exposure. Secondhand smoke can trigger asthma attacks and cause other health problems in children. So in order to protect your loved ones, I would strictly advise you to seek help and use other alternatives such as nicotine patches or nicotine gum to help you quit to ensure the health of your loved ones are not affected by your addiction. Continued use of a substance, despite its causing problems, has been attributed to addiction, habit, and lack of willpower. According to a randomized questionnaire answered by smokers, most smokers attributed inability to stop smoking to addiction 88%, habit 88%, and stress 62%. After researching smoking, I understand that an addiction is a chronic dysfunction of the brain system that involves reward, motivation, and memory. It's about the way your body craves a substance or behavior, especially if it causes a compulsive or obsessive pursuit of reward and lack of concern over consequences, according to Healthline. Although smoking is an addiction, it can be solved with treatment, alternatives, and motivation. I want you to quit smoking and understand why and how it will benefit you. Medical News Today with medical professional Nick Villalobos has outlined the timeline in which events happen after quitting smoking. 20 minutes after quitting, heart rate drops and begins to return back to normal. 12 to 24 hours after quitting, bloodstream becomes nicotine-free, the risk of heart attack declines. Within a couple of days, carbon monoxide levels in blood return to normal. Within a few years, blood pressure and heart rate return to normal. the person will feel normal again. All smokers should make an effort to cut down to reduce the urge and eventually stop to decrease chances of disease and cancers. Quitting smoking is essential, especially those that could be affecting loved ones' health. Imagining a scenario where you smoke around your pregnant wife while allowing your wife to inhale secondhand smoke the whole pregnancy. The baby has sudden infant damage syndrome and passes away due to your addiction. Now imagine a scenario where the baby survives. The secondhand smoke that you have produced has affected the weight of your newborn baby and now has lifelong asthma. So, as I have explained to you the dangers of smoking, I strongly encourage you to quit. Cigarette smoking causes about 1 of every 5 deaths in the United States each year, which includes secondhand smoking deaths. For these reasons, I will never smoke, as I do not want to increase my chances of disease or cancer. And I encourage you to do the same. Use alternatives to cigarettes such as nicotine patches, gum, and to reduce your urge to protect yourself and your loved ones.